it started, I think you know how it started. It started in the 2019. Uh, the world was stunned by the spread of that COVID-19. So people had to hide in their homes, fear of contracting the disease. Pe- People had to hide in their homes for fear of contracting the disease. Lockdowns were imposed. People panicked, and their interest was limited to providing them food and caring for their health. And so the effect of isolation, there was isolation and prevention of social interaction. I think now you see we have got terms like social distancing. hmm, We have to socially distance ourselves. So the effects we had, there was that which was apparent in the individual's psychological behavior. It's so unfortunate that the incidence of that there was the incidence of depression, anxiety, and domestic violence. Some of us had never lived in our homes for quite a big period of time. It affected us negatively in our family stability. You can go to the next slide. This is energy controlling. You can go to the next slide. So when the coronavirus first hit, we go to the next slide of the biopsychosocial crisis, biopsychosocial model. So so in contrast, that is my organ. In contrast, the psychosocial impact was evident. Mm. The psychosocial impact was evident in the unprecedented increase in domestic violence rates. Why it is. Hello. Open that part of the biopsychosocial model. Open the part of the biopsychosocial model of health. Hmm? Angelina, because the smile will Google Meet. So theoretically, the situation can be described as the situation that we are going on can be described as a typical picture of the biopsychosocial model of health and illness, which is a patient-centered model. So the model studies the interaction between three factors: the biological, of which we have the COVID-19 and the stress that happens to our bodies. Then we have the psychological, and then the social interaction. So when we look at the biopsychosocial model, it's like it's comparable. It's cooking for us here in Africa. When we cook, for us here in Africa, when we cook, we use three cooking. We use we use we, three cooking stones. So each of those stones where the saucepan sits, as so
Scroll yes, scroll up. So when we look at the biological model, we see genes, we see nutrition, and the effect of COVID-19 evidently comes in the biological side. Hello?
You can continue.
So when you see the biological model, we see genes, we see nutrition, We see the social stress, psychological, then we see our psychological deals with our emotions and our behaviors. So, so when we so as Africans, for us here, when cooking, we use three cooking stoves. So when we use three cooking stones, each of the stones is very important in order to balance the saucepan cooking food. It is the same with the biopsychosocial model. Once one once one of the pyramids in that Venn diagram, once the biological part of your health is not well, then the psychological and the social are not well. So you can scroll up. Dr. Shelter again. So the biological model states that it teaches us that determination of health and disease depends on the dynamic interaction of those three things that I've told you: the biological, psychosocial, and social factors. You can scroll up. So the bio, it concerns with the biological aspect to do with our health, like COVID-19. COVID-19 is concerned, it is all about our biological aspect, our health, our harm to our body, the harm to our bodies. Can scroll up. Please scroll up. So this concerns the psychological aspects related to emotions. How do you understand what our emotions are? Our thoughts or behaviors. So in the COVID-19 situation, quarantine and sudden change in lifestyle were one of the most significant causes of deteriorations of people's psychological status. Here in our country, here in Uganda, people that were coming from countries that were perceived to be having COVID-19, to be affected by COVID-19, they were isolated, they were put in quarantine, whereby they had to spend 14 days before they leave. So that affected their psychological well-being, with fear of contracting the disease, fear of being a disease vector, to be the one distributing it to different people. So there are so many things that come in the psychological part. So when we say psycho, we mean about our emotions, our thoughts, or behaviors. So with COVID-19, if one currently gets COVID-19, he or she, the first thing is to fear the disease, that it is going to affect you. Maybe you're going to die. Maybe people are going to isolate you. I've known of a place where somebody got COVID-19 and all the family members were denied to get water from the water point where they could get water. Don't you think that psychologically it affected them? You can scroll up. So the social entity, this is the most thing that is really evident for even someone who is not a psychologist can know. So the social part concerns social aspects such as influencing people's health as individuals, groups, and communities. Now with COVID-19, most in our country, like for us in Uganda, we've been working on what they call SOPs, standard operating procedures. You are not supposed to be in a meeting that exceeds 5 people. We are supposed to be stationary. There's that thing that World Health Organization brought about. Social distancing. We are not supposed to touch our hands. We are not supposed to touch the nose. They are called the main. The eyes, nose, and mouth. They are called the main. So we are not supposed. Here, our president Museveni calls them the soft parts. So with that,
Here with our African culture, we are used, if I'm to greet you, I have to touch your hands, I have to shake. But now, but now we cannot. So in the social aspect, it concerns such things. We used to have parties, we used to be happy, we used to. So socially, it has, COVID-19 is truly a biopsychosocial crisis. In the way, in the social aspect, we can, so we don't have the we are not supposed to relate with so many people. But however, this also affects the psychological part. It affects the psychological entity of the biopsychosocial crisis, and ending up affecting the biological one. You can scroll up, scroll up. So the world appeared with this, with the social crisis, social aspect, the world appeared unready to face such a crisis. The most affected social groups were the poor and those with low incomes. Here in our country, people that were doing unprofessional jobs, people selling food in markets, were not supposed. With low incomes, especially in countries that did not take adequate measures to ensure food security. The elderly people with chronic illnesses were more likely to contract the disease. Therefore, it was difficult for them to cope. The pandemic caused an imbalance in the family, in the way that we are often unable to explain what is going on to our young children. You can scroll up. Furthermore, the inability of family members to fulfill their social role, it may trigger problems caused by increased tension that may lead to more biological or psychological problems. So the overlap between the bio, psycho, and social status among the coronavirus patients was very prominent. So it is not an individual case or specific to society or group. On the contrary, it is a general case that is applicable everywhere. You can scroll up. You can scroll up. So I really extend my thanks to you and nice meeting you. He will give you my email, which is kasangaki@gmail.com. I'm waiting for any questions. I'm very sorry for coming in late. My internet connection was a problem at the beginning. I ended up using my phone. I really wanted to use a computer. And I'm open to answer any question from you about COVID-19 as being a wide biopsychosocial crisis. But when you see what I've explained, each 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 of the pillars that I've explained, the bio, when you get sick, it affects your psychological well-being, and your psychological well-being affects your social well-being. So thank you so much. Here in Uganda we say mwebale nnyo, mwebalire ddala. To mean thank you, I don't know how you say it in India, but I'm open to answer any questions. Any questions before I leave? Any questions?
Thank you so much. Uh,
We have to hear you about the experience of the Bidi Bidi Refugee Center in few words from you. If can you explain the experience or the way you help those refugee center?
Hmm. So Uganda is one of the countries that hosts the largest number of refugees in Uganda. So in Uganda, we have the biggest refugee settlement in Africa. So it hosts mostly, have you heard of South Sudanese? I think you've heard of the South Sudanese crisis. So in Uganda, Uganda hosts them. So what we do is to give them psychosocial support in form of counseling and then identification of referral pathways to help them. Dr. Shelter again. Yes, any more question? Any more
If
question?
anyone else has a question, he or she can put forward.
Mm. Some proposes bawuliriza abantu zaba Australia. Hello?
I think there is no more question right now. We are very glad to have you with our platform on our platform, and I would like to request you to kindly put your email in chat box so anyone who wants to contact your any question, he or she can be in your contact in future. So
My email in the chat box.